prostate MRI, they've been around in some form, probably 5 or 6 or more years, but it's just in the last couple of years that the current iteration of the test is available, and it's much more accurate than it was in the past. Are we at the final place with? No, the prostate MRI is going to continue to improve year after year, but right now, with the studies that have been done, it's very clear that the prostate MRI, again, you cannot use it in and of it only by itself, but it's very clear that the prostate MRI can help characterize the risk of somebody, characterize where the cancer is, the extent of the cancer and the extent of the spread of the cancer, in conjunction with the PSA clinical exam and a test like the PCA3 test. We have been able to do is use these new tests to isolate or to identify people who meet the criteria for active surveillance, which is having a low risk or very low risk, prostate cancer, and there are a number of criteria that fit that. So none of the individual tests by themselves can be used absolutely, but when you put them all together, you look at the combination of tests, how many of the tests, put you into low risk, or maybe there's some that put you into intermediate risk, but when you look at it in total, then that, helps me, as a physician, along with the patient, to understand where the risk is, and help guide recommendations for treatment going forward. The tests have only been available, for several years, and we've been using them just this is the second year that we're using them, so it's still early on to see what the long-term outcomes will be. But so far, we've not had any patients in active surveillance whose cancer have progressed.